All right, well, it is 12:01, so everyone, thanks for joining us today, August 27th, 2020. Would someone like to lead us in the pledge? Any takers? Amy?
Okay, here we go. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God,
indivisible, with liberty
and justice for all. And I don't have a flag, I'm sorry.
Oh, that's all right.
Thank you, Guy.
Guy had one. Yeah, Guy came through for us. Thanks, Guy. All right, so yeah, we have a good program today. Doug's going to talk to us here in a few minutes. I've got a few things for today in history. Some days I find it's harder than others to find stuff that happened in the past on a particular day. But 1921, the owner of Acme Packing Company bought a pro football team from Green Bay, Wisconsin. J.E. Clare paid tribute to those who worked in his plant by naming the team the Green Bay Packers. And the purchase price was $100, which is probably about a fifth of what they're worth today, at least. Actually, today they're worth $2.85 billion, so that $100 purchase was a pretty good deal. Let's see, 1955, the Guinness Book of World Records, compiled by student twins Norris and Ross McWhirter, is published for the first time and becomes an instant success. The book was originally owned by the Guinness Brewery, hence the name. It's currently owned by the Jim Pattison Group, which Dave Heater would know about, which is the same company who owns Ripley Entertainment Incorporated. Guinness Book of World Records holds its own world record as the most sold copyrighted book. And last but not least, 2003, Mars made its closest approach to Earth in 60,000 years as it came less than 35 million miles from the Earth's center. The next time Mars will have a close approach will be October 6, 2020, when it will come within 38.6 million miles. So we've got that to look forward to in a couple months, I guess. Some big news a couple days ago. I don't know if everyone saw this in the news, but Africa was officially declared free of wild polio after 4 years with no cases. So I found a neat little video that's about 4 minutes long that John's going to key up that I thought everyone would enjoy. So.
The journey to ridding a continent of wild polio, most devastating diseases of all time, is one of courage, resolve, and collaboration.
August 25th, 2020 marks a huge day in the history of the fight against polio. After 4 years without a case of wild polio, the WHO African region has finally been declared free of wild polio virus.
Only a generation ago, in the early 90s, wild polio was paralyzing 75,000 children every year in Africa.
I was hospitalized for 2 full years. I was just sleeping in bed without even being able to turn your head, nothing. All I could do was just to talk, but I couldn't even move any part, even my fingers. I couldn't feel anything.
In 1988, the World Health Assembly endorsed a resolution to eradicate polio worldwide, launching the Global Polio Eradication Initiative.
In 1996, the African heads of state came together in Cameroon to declare the commitment to eradicate polio from Africa.
Also this year, the great Nelson Mandela, with Rotary International, launched the Kick Polio Out of Africa campaign, uniting Africans together behind a common goal: to vaccinate every child against polio.
Across the region, we saw an increase in investment, leaders rallying together, and communities mobilized all across Africa for polio eradication. We started to see a decline in the number of polio cases. It is then that we realized that it was possible to eradicate polio from Africa. In many parts of Africa, there are areas of conflict, and anywhere there's conflict, then there's always that challenge to accessing children. You have areas that are hard to reach. There are geographical areas that have water, mountainous areas, desert areas.
Il fallait utiliser plusieurs moyens. Je peux citer bien sûr le véhicule, les motos, mais plus compliqué encore, on a utilisé des pirogues motorisées, même des pirogues non motorisées pour transporter les vaccins, pour que ces vaccins arrivent là où les enfants se trouvent.
Reaching every last African child with the polio vaccine has required countless acts of extraordinary bravery.
There was an attack or bomb blast, and 1 hour after, the teams continued their work. Whatever achievement we have made, I give it to these frontline health workers. They are the heroes that have made polio eradication to be possible.
This is a story of innovation and communities coming together towards one unified goal.
Fundamentalmente, foi a implementação de campanhas de vacinação de base comunitária e também melhorar a vigilância epidemiológica, assim nós podemos ter uma resposta oportuna.
The drive for eradication has been a truly collective effort.
This is thanks to the governments, donors, non-governmental organizations, communities, and their leaders who have been with us every step of this journey.
Today, Africa's health systems and public health programs are much stronger because of the vast investments made to eradicate polio.
The polio eradication program has a huge footprint of expertise and infrastructure. As we speak, the polio infrastructure is being used to respond to the COVID-19 response.
We must continue to protect Africa's children against all forms of polio and other childhood diseases, ensuring they are protected by immunization. And we must take the lessons learned and best practices from eradicating wild polio virus to achieve Africa's other public health goals and improve healthcare for all Africans.
All right, well, thanks for playing that, John. That's pretty exciting news. And I guess that was a WHO video, but it had some pretty good plugs for Rotary in it too. So the only two countries where polio remains is Pakistan and Afghanistan. And so hopefully we'll close in on those two and the world will be free of it sooner or later. So let's see, any other announcements before we get into the program here? Diane, you want to talk a little bit about the vocational committee?
Sure, thank you, Freddie. The vocational committee met today, and you should be expecting an email from me through DACDB. In that email, I'm going to explain to you how we're doing vocational lunches this year. And for now, we'll do them on Zoom. I will give you a range of choices of days to pick from, and we decided to, if we can have enough members that are interested, we'll have two Zoom vocational lunches a month. And if you participate, you'll receive a makeup. In that email, I'll explain the process about how it works, and I'll ask you to respond to my request and let our committee know that you're interested and what days work for you. And if more than one day works, let us know that, and then we will divide those who are interested up into two vocational lunches. Let's see. We also anticipate, we're really excited about getting the vocational lunches started, and we anticipate starting them in the October timeframe. And if anybody has any questions, I can answer them. Okay, thank you, Freddie.
All right, thanks, Diane. Anyone else have any announcements? I don't see any hands.
Freddie, I had
Oh,
a
Amy? Okay.
comment about the polio. Because I didn't realize, I'd never heard it called the wild polio virus before, so I looked it up, and I don't know if everyone knows this, but basically they've eradicated types 2 and 3, and only polio 1 is the one that's existing, and they refer to it as that. So I just didn't know that. Thought people might find that interesting.
That is interesting. I kind of wondered what the wild versus unwild would be too. So, any other announcements?
Hey Freddie, it's Laura. I don't have video today.
Hey, Laura.
We're going to have a mini ABCs of Rotary event for our new Rotarians to become more familiar with Rotary on September 22nd from 5:30 to 7 via Zoom. And I sent an email out to committee chairs to see if I could get elevator speeches about their committee and if they had any recruitment needs, and kind of put it on their radar. So if you have any questions, please let me know.
All right, thanks, Laura.
And anybody who wants an authentic elevator speech, we have 2 elevators here that generally work. So you can come over and actually get in one and give your speech if you want.
Good practice. All right, well, thanks. I see our Sergeant of Arms is on here today with us. You have anything for us, Bob? I think you're muted still, Bob.
Freddie, real quick, I just wanted to say that I have Patty Eisler. I'm in the Lincoln City branch today, and she's the manager and a Lincoln City Rotarian. She's on this with me. I just want to make sure she gets makeup credit for that. I don't know who's taking attendance, but welcome.
You want to just send an email to Jim Graham? He does makeups. Just send an email and let him know who it is.
Okay, we can do that.
All right, welcome, Patty. There's Bob.
Here's Bob. Can you hear me now?
Yes.
Oh, good. So DMAR is there. Hi, DMAR. I see you.
Bob, how are you?
Oh, I'm good. I'm really, really good. I saw your picture in the paper, DMAR.
Where?
I'm sitting at my desk looking at your picture in the paper.
Was that up at the new apartment buildings?
Yeah, it looks like it is.
How do you know it's me? I have a mask on.
That's how I knew.
I don't think it's me, Bob. I think it's somebody in disguise that kind of looks like me up from the nose up.
Well, I tell you, those legs, it's you, DMAR.
Yeah, that's me. Yeah, I'm real happy that the 110 units are now being rented out, and that the city was very proactive in getting those built. And I think if we can do as a city, if we can get some more of those in place, I'd be happy to stand in front of them again and pay you some money. I think is what you're looking for, right?
No, I'm not looking for money. I just want to know how happy you really were.
Well, I'm pretty happy that we have some housing for some of the people that can least afford it. Those units are going for like $600, $700, $800, 1, 2, 3 bedroom units, and their demand is more than there is housing available. So we could use some more of those if we can figure out some way to do it.
Well, I'm sure you will, because you've been doing a good job on city council, and I just think, I have a feeling that you'll find something. Now, how happy are you?
Well, $25 make you happy, Bob?
That makes me happy. Makes me real happy.
That makes me happy because I don't have to pay you 100. So.
Yeah, no, 25 is fine.
Okay, thank you.
Is Ursula there today, Ursula? Anybody see Ursula? Are there any other happy dollars out there? Dee, I'm just looking at your face and I can't help it. I mean, you've got this big smile on your face, like you've done something.
I'm always happy, Bob. You know me. We're just doing lots of outreach and lots of good, fun, happy things. I'll do some happy dollars for Ursula since I don't think she's on here. But she and I just recently collaborated around getting prescription food out to people in need. And so that's making me really happy. I'll be $10 happy for that.
Well, good, good. When you're $10 happy, everybody's happy. Anybody else? Anybody? Well, nobody's very happy. All right. Well, okay, if that's all the happiness we've got, that's all we've got. Freddie, I'm turning it back over to you.
All right. Well, thanks, Bob. So today's program, our speaker needs a little introduction because he is a fellow Rotarian. Doug Hunt, who has been a county commissioner since, June 2012, I think, according to my notes.
That's correct.
2012 and going strong today. Doug is going to talk to us a little bit about the county response to COVID. So take it away, Doug.
Okay, thank you, Freddie. And I guess a couple of cautionary remarks as I start. First of all, I'm happy to answer any questions as I'm going through the presentation. Raise your hands, holler. I'll let Freddie or John try to, I guess, manage the process if it gets confusing. Diane Nelson, you say you can't hear me?
Right. That's better.
Oh, okay. I had some notes on my laptop. Is that better now?
Yes, it is.
All right. Well, so much for notes in front of me. Second of all, you'll hear me talk about the volatility of this situation and things changing day to day. And so if something has happened in the last 30 minutes that contradicts what I'm saying, let me know because it's probably true. So with that, John, if you want to go to the first slide, hate to start out a presentation with a bunch of statistics, but I am a banker, I am a numbers guy. And I think this kind of will set the framework for the remainder of my remarks. And on the left, you'll see historical data as far as cases in Oregon, the percentage, excuse me, that should be percentage, not end, percentage of positive cases, the deaths, and those are not cumulative, but they're by month. So April had 883 cases, July had 1,732. Those are not cumulative numbers, obviously. Same with deaths. And then on the right-hand side, you'll see counties. And without going through the details specifically, there are a couple of things that I think this chart kind of points out. Number one, if you look at the state of Oregon, the percentage of positive cases really for the first, and again, I didn't do prior to April simply because the data is varied. There was changes in how the information was reported, and it really doesn't change the overall picture. So although the first case in Oregon was on February 28th, again, I didn't start the numbers here until April. But if you look at April, May, and June, really, as far as Oregon, the percentage of positive cases, we're kind of in the same range. In July, you saw a big jump, and that is about the time the governor got more involved. In fact, July 17th is when she mandated masks, and you'll see some more important dates on the next slide. But looking over at the county side, the county was really had very little cases at all, as you can see in April and May. And then in June, we had the outbreak at the Pacific Seafoods, and really it overwhelmed the county. We had 312 cases and 9.3% positive. And the reason I think those are significant is if you look back in the month of May, the county had done some things to really reduce the social interaction and the ability to, and the risk to individuals. So as far as sources, I'd refer you to the Oregon Health Authority site. The link is at the bottom, and then again, the county website has a variety of COVID information. So with that, let's go to slide 2, and I'll take my paper off my speaker or microphone, sorry. Here are some important dates. On March 13th is when the county declared an emergency. That emergency declaration is in effect through September 4th, which coincides with the date the governor's date. I expect that the county and the governor will extend that date, and we'll probably extend our date to coincide with the governor's date. March 23rd is when the governor first ordered the stay-at-home guideline. That was the baseline that you'll hear me refer to later. And then, as I indicated back in the last slide, the county did some things that really limited the spread of the virus in the months of March and April. And primarily was the meeting on March 23rd when the county and the cities got together and closed short-term rentals, short-term renting. That applied not only to short-term rentals, VRDs, STRs, but also to hotels, motels, campgrounds, RV parks. So the only thing that was allowed in the entire county, because the cities and the county agreed, otherwise anything the county enacts is only applicable in the unincorporated areas, but we closed short-term rentals. So with the short-term renting closed and the governor's baseline, that really limited social interaction. And again, referring to that first slide, you can see that was very effective in limiting the spread of the virus within our county. On May 22nd, the county entered phase 1. We were approved by the governor on May 21st, and we voted to go to phase 1 on May 22nd. I was the only commissioner that voted against that. I have from the beginning felt that we have been much too quick to open the county, and I think that when you look at the outbreaks and the percentage of positive cases in the county compared to the state, I think there's some support for my feelings. And then, as I indicated, on June 6th, we had the Pacific seafood outbreak. There were 187 employees that were identified with that outbreak. And since then, we've had 9 other outbreaks, 10 total. And we currently have 3 in Lincoln City, 1 at the Hillside Care Center, and then 1 at the Surf Tides Hotel, and most recently 1 at the Inn at Spanish Head. I have a lot of questions about why doesn't more businesses where there's rumors on social media or other avenues that there are outbreaks. And by law, the county is limited from publicly announcing outbreaks unless there are 5 confirmed cases at an individual business. So there are other reported, rumored outbreaks of different employees, different businesses, but we're legally not able to report them. Again, as a result of the outbreak, the governor placed us on her watch list on July 3rd, which coincidentally or not was Friday, the day before July 4th. On the 17th, the governor mandated face-wide coverings. On July 30th, we were removed from the governor's watch list because we had, in effect, hired some more case tracers and case studies, if you will, or case workers. The county applied on August 6th to enter phase 2. And again, it's an application to the governor's office. Again, I voted against it, but I was outvoted. The county wanted to go to phase 2 on August 24th. And on August 20th, which happened to be the day that we had scheduled an emergency meeting in anticipation of the governor's reply, since we did not know whether or not we would be approved to go to the phase 2 on the 24th. But on the 20th, we did receive a response that said the governor approved us moving into phase 2 effective Tuesday, September 8th, the day after Labor Day, but with conditions. And you heard me indicate earlier that there was a lot of confusion. So let me read you a couple of statements that will, I think, add some clarity, if I can find them, to the confusion. So in a minute, I'll talk about the public indicators. There's 6 of them, but on the website where they're identified, it says, these public health indicators help inform our recommendations. And again, this is the state OHA speaking. Help inform our recommendations, but do not reflect actual decisions about a county's reopening status. We look at these indicators in context to one another and to other information. If a county does not meet any one indicator, this does not define final decisions for reopening this county. So let me quote selectively from the letter that Governor Brown sent on August 20th. And it says, we have been in discussions with you about opening the county on September 8th, 2020. We have been carefully monitoring your case trends, and over the last 2 weeks, there has been an increase in positivity, slightly higher than the criteria to enter phase 2. However, we anticipate that your county will stabilize and will be able to enter phase 2 by the target date of September 8th, 2020, if you continue to test, track, and isolate new cases for COVID-19. Your county will need to continue close monitoring of OHA's 6 public health indicators to manage any increase in new cases. So I don't know if you're like me, it's kind of clear as mud. So John, if you want to go to the next slide after the dates, that should give you, here are the public indicators. Oh, excuse me, I moved my slide. So what are the major differences between phase 1 and phase 2? A lot of people say, oh God, we got to go to phase 2, open the county. Well, the reality is there really aren't major differences except when it comes to events, sports, which is the 3rd bullet point. When it comes to gatherings and indoor get-togethers, they're still limited to 50, but now on phase 2, outdoor gatherings of up to 100 would be allowed with social distancing. Restaurants and bars, there's really no significant change. The calculation, restaurants can now open booths seating and counter seating, but not bar seating. But that was really the only major difference with restaurants and bars. Events, sporting arenas, pool spas, what you see there, cannot open under phase 1, but can open under phase 2 with up to 100 people indoors and up to 250 outdoors. Some of you may have seen that I'm a Vikings fan. I was planning to go to the game in Seattle. I don't know, with 250 people in the arena, I'm not sure it'll be a very exciting environment. But anyhow, for what it's worth, if the county goes to phase 2, sporting events can be open. And I will say that the phases are different for different states. I believe Washington has 3 or 4 phases. Oregon only has 2. So once county goes to phase 2, there's really no next phase until the virus is eradicated or under control, for what that's worth. So those are the major differences between phase 1 and phase 2. Otherwise, there's really no significant difference. When it comes to testing, you cannot just walk in and get a test. It still requires a referral from your primary care physician. Testing is also being done if you're scheduled for elective surgery. There are some drive-in locations, and I think, John, if you scroll a little bit lower, yeah, they're on the next page. Okay, there's, in addition to the 3 drive-in locations, you can get a test through the Samaritan My Chart, which is accessible through their website. And then the county has 2 health centers, one in Lincoln City at the north end at the DMV building, and one in the Newport at the what's commonly called the 1010 building. And again, you can schedule appointments and make arrangements to see a physician, and if the physician determines it's appropriate, would refer you for a testing. So that's testing. But again, even when it comes to outbreaks at businesses, the county cannot force those employees to be tested. So we're a little bit at the mercy of the willingness of employees to be subjected to testing, which is particularly challenging when you look at what I'll call the low wage earners, the principal employees at many of these businesses. They're often minorities, and I'll have some data on that shortly. But their livelihood depends on a job. So their willingness to go and get tested, to be quarantined, possibly lose a job, really complicates our efforts to try and track the virus and then quarantine people that may have been exposed in an effort to limit its spread. So if you scroll down a little more, John, I talked about the public health indicators, and again, here will help you with the clarity or lack of clarity. This is information as of August 20th. There are 6. The county met 4 of the 6, but we did not meet the number 4, which is the percentage of cases to be able to be traced to a known source in the last 7 days. We should be able to trace at least 70%, and we are only able to trace about 40%, so we're far below that. And then number 6, we need to follow up. There's really 2 stages. When somebody is identified as having the virus, a contact tracer works with that individual to identify all of the people that that individual may have had contact with. And then a caseworker takes each of those individuals that may have come in contact with that individual that now has been identified as positive, and works to determine with those in secondary individuals who they may have come in contact with, possibly quarantine people for up to 14 days to determine whether or not they have in fact become infected. So to do the trace contacting with an individual can take a couple, 3 hours, maybe 4 hours. To do the case work on that individual, it can take half a day or more. So very time consuming to work with the people that have come in contact with a known infected individual and determine what is the appropriate action for them. So on August 20th, those were the criteria that we didn't meet, but let's back up. Let's go to August 6th. We didn't meet number 4, but we did meet the other 5. And then on August 13th, which was a week later, we didn't meet number 3. We did meet number 4, but then we didn't meet number 6. And if you're confused, now we're at August 20th where we don't meet 4 and we don't meet number 6. So the numbers and what criteria we meet or don't meet change pretty easily. It's very volatile. And again, I refer back to the statement on the website and the governor's letter as far as, okay, I'm a county commissioner. I'm faced with, do we open the county on Tuesday, September 8th? What is the criteria that the governor's office is going to use to state we do meet the conditions in her letter that were identified or referred to as a condition to opening on the 8th? So lots of confusion. But having said that, I continue to believe that reopening the county on the 8th is too early, and I'll get back to that as I conclude my remarks. One of the things that we also have to be aware of is the county isn't directly responsible for education, but for in-classroom instructions, and John, feel free to correct me if I'm wrong, but in a general sense, for in-classroom instruction to take place, a county must meet the 2 criteria there at least 3 weeks in a row. 10 or fewer cases per 100,000 people over 7 days, and test positivity of 5% or less over 7 days. And if you scroll down, I'm sorry, my the layout on my pages got goofed up. I thought they were all on one page, but they're the state metrics. And again, as of the most recent data, we meet the test positivity, but we don't meet the case rate. So different criteria for different aspects of opening the county, whether it's phase 2 or education. All right, let's scroll on. This is really my last page as far as my comments. I'll be happy to answer questions. So as we look at limiting the spread of the virus, as I've indicated, I continue to believe we need to be patient. Certainly face coverings have proven to be an effective, one of the effective ways to limit the spread of the virus. I think we need to continue to limit social interaction. Our county is a magnet for tourists, and while there's no specific data as to the correlation or the relationship between visitors or tourists coming to our county and the spread of the virus, I think when you look at what's happening in Lincoln City with outbreaks at 2 hotels, motels, there's certainly a strong reason to believe that when you have, depending on the time period, 40 to 45% of the cases cannot be traced to a known source, I think it's reasonable to assume that some of those cases are being brought into the county by visitors or tourists. So I continue to want to limit the ability of social interaction within the county in an effort to try to limit the social action and the spread of the virus. We want to continue to wash hands, and soap is the key ingredient. I've read much that says all it takes is soap. Doesn't have to be fancy soap, but wash your hands with soap for 20 seconds. And this bullet point I'm horrible at. You may have already noticed. I'm always got my hand in front of my face, but you want to keep away from, try to avoid doing that. When it comes to personal protective equipment, right now the county more or less is okay. But if you've read any news, when it comes to personal protective equipment, the ability to do testing, we simply at the state level and therefore at the county level aren't receiving the kind of resources that some of the other states nationally are. Again, when you look at our state and our number of cases and deaths, rate of positivity, we're relatively low nationally, but that means that a lot of the resources that are available are going to those other states. And frankly, it's difficult to get the type of equipment and testing that we would like. And if you were to look at the number of tests done monthly, back in the summer, we were in a neighborhood of 400 or 500 a month in Oregon, and we're now down around 200 a month in Oregon. So that continues to be a challenge. And finally, talk about enforcement. That's a big challenge. Recently at the Board of Commissioners meeting, the sheriff indicated he's got limited resources. I think you heard last week at the Rotary meeting from Chief, what's the chief? City chief. I knew I'd forget his name.
Boy.
Yeah. They've got limited resources. So you know, a lot of people have said, well, you know, you need to write more tickets. Well, if you violate the governor's order, it's a crime. And I certainly agree. I'm not sure we want to start making criminals of people that don't support their comply with the governor's executive order. On the other hand, I think there's some things we can do, is possibly write citations, do a better job of educating, and maybe I think there's a possibility that this district attorney would agree to handle the violations of citations and avoid criminalizing people that are not in compliance with the governor's order. But bottom line is there's limited resources, and it's a struggle. So finally, as far as looking forward, I've already indicated that I believe we need to go slowly. If you look at the trends over the last 3 or 4 weeks in our county, the positivity rate has increased. We're above the state average. If you look at the impact of the virus on minorities or low wage earners, of the roughly 450 some odd cases in our county, over 50% are Hispanic or Latinx. And if you look at the county population in general, it's about 10%. So far disproportionate impact on our minorities, low wage earners, and frankly, those individuals and families that are really vulnerable and on the edge of homelessness or other financial challenges. So I think we need to be particularly cognizant of that. And I'm concerned as we reopen that it will continue to have a disproportionate impact on those individuals. I've already mentioned the reopening of schools. I think if we want to get in classroom instruction, I'm a former school board member, and education is one of the big keys to the success of any individual. So we need to get our schools reopened, and we need to get our education back on process. And finally, flu season is coming. So when you look at the infection trends, you look at the impact on minorities, you look at the need to get schools open, and you look at the risk of the flu season, I'm not in favor of trying to open the county on September 8th. I think a reasonable date might be later in the month, Tuesday the 29th, which of course would be after a Monday Board of Commissioners meeting. But we'll be having the Board of Commissioners will be having a discussion on Monday the 31st, and the outcome of that discussion, I don't know, but time will tell. So with that, I'd be happy to answer any questions.
I have one, Doug.
Sure, go ahead. I think that's Keith, if I recognize the voice.
Yes, it is. I'm just curious how you weigh your decision-making process in what's safe for us versus the economic considerations for, like you talked about, the minority folks that are between a job and homelessness. How do you weigh your decision-making to keep us closed or to open us up? Personally, how do you do that?
Well, I'm a banker, and I certainly understand the risks of business, and I certainly understand the role of businesses in our economy. But I look at it this way. If you look at the resources that are available for businesses, there are, and it's on our website, there are literally dozens of federal programs that provide money, financial support to businesses. There are certainly a handful or more of programs available from the state. Even within the county, you have cities, off the top of my head, Lincoln City, Newport, Yachats, and the county have programs that make funds available in support of the businesses. When you look at the employees, the individuals, there has been some additional support through unemployment, but even that has, well, at one point it was terminated, and it now may be reinstated, but at a much lower level. But the bottom line is, I ask myself this question. If you are a business and your business suffers lost revenues or closes, that certainly is devastating. But if you're an individual and you lose a loved one or a family member to the virus, that family member probably has been in isolation. In fact, most likely has been in isolation in the hospital, has been all on their own in ICU, has died alone. I think that is far more devastating than the impact that reduced business or closed businesses has, and therefore I use that as my guide when it comes to trying to make decisions that recognize the challenges of both issues. And I'll also reference the mayor of Seattle. A long time ago, earlier 3-4 months ago, I heard her on a news broadcast, and she made the comment that I think really strikes to the heart of the matter. There are no good choices. All we can try to do is make good decisions. So that's my feeling on that issue.
Well, thank you for your service and thank you what you guys are doing. I absolutely would not want to be one of the decision makers in this. I really appreciate what you all do and how serious you take it. So thank you.
Thank you.
Other questions?
I had a question.
I've got a question.
Let Corin or
Corinne.
Sorry.
It's okay. So with contact tracing, if the people do come in contact with them, are they is quarantining the only option, or can they go get a COVID test as well?
I'm not an expert on that, but my guess would be that if the contact tracer, actually it would probably be the case worker, talks to that individual and they have symptoms, probably that person would be referred to their physician, or if they don't have one, they can go to the county. And after a consultation with a physician there, if the physician made the determination that it was appropriate to refer them for a test, they could get the test. My speculation would be that if they don't have symptoms, again, depending on the overall circumstances, they might be asked to quarantine for 14 days. John, I think you had a question.
I have a question. So what was the thinking behind the commission about waiving the requirement for people of color not to wear face coverings? I know you took a lot of heat for that, but it seemed like that was more political correctness than science. And I'm sure you regret it, but I don't think any other jurisdiction even tried that. I thought that was kind of silly.
Well, I will say I don't regret it, and let me explain why. When we, you have to back up, when the county Board of Commissioners on a Monday decided that we didn't know at that time if the governor was going to issue a mandate for face coverings or not. And as I indicated, she did that, I believe it was on a Thursday, which was the 3rd or maybe Friday, the 4th of July. Well, the prior Monday of that week on the Board of Commissioners meeting, we had decided that, well, we could only mandate face coverings in the unincorporated areas. By issuing a directive throughout the county, that would at least be stronger than doing nothing, quote unquote. So in our directive, we made 4 exclusions. Number 1 was people that had a physical disability where wearing a face covering would impede their health. Second of all, we made an exception for people that had some mental illness, some mental concerns where wearing a face covering would be detrimental to them. Third, we said that if you're children do not need to wear face coverings. And fourth, we recognize the racial injustice, and we understood at the time that the 4th exception would possibly be controversial, and it certainly turned out to be so. But we said, we understand that people of color have been subjected to harassment, have been subjected to violence, and if they felt that by wearing a face covering, they would incur additional discrimination, harassment, or violence, we acknowledged that that's part of trying to address that concern, that we would allow them not to wear a mask. Well, the national media made an issue out of that and basically said, well, Lincoln County has said you're only white if only white people have to wear masks. Well, that wasn't what the directive said, and that wasn't the intent of the directive. But after further consultation with leaders of people of color, they advised us that really, well, the effort may have been in the right vein. It actually was being detrimental. So we issued a subsequent statement that said, the county included that exclusion in an effort to recognize racial injustice. We continue to feel that that's a valid concern, but we will remove that exclusion from the directive because of the impact it's having on the exact people we're trying to help. And for the record, that statement was signed by all 3 commissioners and all elected officials and department directors, which is a total of about 19 or 20 people in the county.
Okay, thank you.
You bet.
All right, any other questions?
Amy, you got a question?
Well, I kind of have a comment, I guess, about putting off phase 2. And my concern is that the fact that we wouldn't be able to do sports outside. And it's a real shame because we have a lot of kids that probably would be diagnosed as clinically depressed right now. And this would be a way for them to be outside in a healthy environment that you could control. Having practice, because they're already going out there anyway on their own a lot of times. But this way a coach would be present or someone that would be directing them to do a practice. And I think it's a real shame, honestly. And it makes me sad because I, as a coach for like middle school girls, they are having a real social deficit, and this would be a positive way to do it. And until phase 2 comes into play, the city won't even, agree to opening up any of its fields. The school district won't open up any of its fields because of liability until we go to a hybrid situation. And I think it's something that we strongly need to revisit. It doesn't make sense to me because most of the data says that doing things outside is the best thing that we can do. So
I appreciate your comments. And
I have a question.
Yeah, just a minute, Jim. If, it would be interesting, is there a way to carve out something for high school sports versus all outside sports? But, again, the only comment I would offer is that when you're outside and you've got people running and, exerting themselves, that involves a lot of heavy breathing, and social distancing and wearing masks becomes a bit of a challenge. But I understand your concerns. Jim, you had a question?
Doug, how would you define the effectiveness of our contract tracers in the county here? It seems that you have these areas where you cannot legally say who's at issue, but there's rumors up. Are they effective in their job tracing those people?
Well, I think the question would probably the degree of effectiveness versus what you might like to see. And again, when the outbreak at Pacific Seafood happened, at the time we thought based on the state criteria, we had an adequate number of contact tracers and case workers. But when the Pacific Seafood outbreak occurred, we realized we were woefully inadequate. We've since hired a considerable number of people. I don't know the number off the top of my head, but certainly at least doubled, possibly tripled some of the people in those areas. And when we get cooperation and have the time, if you will, to do the work, I think it can be effective, and it is effective. It would probably be more effective if people weren't afraid of losing their jobs, if people weren't afraid of being quarantined. I will say that there was a lot of rumor that when a person was put in quarantine or placed themselves in quarantine, they were just isolated and left all on their own. No, the caseworkers are in daily contact with the people that are in quarantine to make sure that their needs, whether they be health, food, psychological, that sort of thing, that their healths are being met daily. So with more people and more cooperation, we would do better. But I think given the circumstances, we're certainly effective.
Thank you.
Doug, I have a question for you.
Sure, Dustin.
So the CDC came out with their new guidelines that basically asymptomatic people no longer need to be tested. So how's OHA and the county it seems like, there's this whole network set up right now for a testing process that now the CDC is saying anyone who's asymptomatic doesn't need to be tested. How does that work and change the county's perspective moving forward?
Well, I think that's a fairly recent announcement, and frankly, I'd have to refer to Rebecca Austin, our Director of Public Health. But one of the things that concerns me is the people that are asymptomatic, they don't know they have the virus. So when they're out and about, they may not be as conscious of the needs to try to limit the spread. And then the other thing, which may be a reflection of the CDC's decision, somebody can be tested, and depending on how effective or how responsive the testing process is, ideally, depending on their different methods and different labs, it can be, I guess, I'm not sure if it can be the same day or the next day, but a day or two. And for a period of time, we were actually going 14 days before getting results. So with that in mind, if a person is tested and determined to be negative, they can go out and get reinfected the next day. So testing asymptomatic people, there's certainly some pluses and some minuses, and that may be reflected in the CDC statement. But I don't know, I tend to believe that the testing is the best way to understand how prevalent the virus is in our county and can help provide some indirect support or influences on what other decisions we might make.
Thank you. Yeah, I think that's an interesting, perspective when you think about 40% or something people may not show symptoms, but then the CDC has been saying throughout the whole process, and OHA has been saying, well, you need to get tested. It's all about testing. It's all about testing. And now the CDC is saying asymptomatic people don't need to be tested. I wonder, it'd be interesting to see how you guys are going to respond to that. And I guess the question is OHA has to follow CDC guidelines, and therefore the county has to follow OHA guidelines. So it's not really up to anyone, right? I mean, the CDC makes a determination, OHA has to follow it, and then you guys have to follow it. Isn't that right?
Well, I chuckled because I think that goes back to the volatility, and who knows what the guidelines are at times. I may be wrong, but I'm not sure the state has to follow the CD guidelines. I mean, there are guidelines, and whether or not the county has to follow those guidelines or not, I don't know. But certainly, as I've said, I think there is value in testing.
Okay. Thank you.
Yep. Jeff Otterkirk, I think I saw your hand.
Yeah, Doug, I guess it's, bearing in mind that the whole lockdown originally was to try and not overwhelm healthcare facilities. So, does the county have a position with respect to, I want to say something like the acceptable number of cases? And we could say none, but the reality seems to be that this stuff is going to be out there. It's going to circulate. There are a lot of asymptomatic people. I was reading something in the New York Times Magazine section. They're saying there are a lot of asymptomatic kids who end up being the vectors. And so, to Dustin's point, if you're not testing and you don't know who's asymptomatic, you're basically saying, no, go out there and run free, I guess. And if you infect people, well, that's part of the process on the way to herd immunity. But, how's the county looking at that, Doug, I guess?
Well, right now.
Hey, everyone. The most recent news is that CDC change came from the Trump White House, and then CDC is now revisiting that. A number of governors in the Northeast have all said that they're not going to follow those guidelines.
Good point.
Well, I was going to say I think that's largely political, but I was biting my tongue. Back to your comment, Jeff. I will say that At no point during the virus pandemic has our hospital system been overwhelmed. I think there have been a couple of times, particularly with the Pacific seafood outbreak, and then recently when there appeared to be a spike in the number of cases, that there was some concern as far as what kind of a burden the outbreaks would put on our hospitals. But really, the outbreaks are having the area of concern as far as the personal protective equipment, whether it be face coverings, protective gowns, gloves, that sort of thing. That's where the real area of concern is. It was pretty clear that when the Pacific seafood outbreak occurred that the county didn't have enough staff. We have more staff now. We hope it's adequate. But again, when one person is identified as having the virus and they come in contact with a dozen or more people, it takes a long time to do the research on those dozen people. And I think there was a slide before the Board of Commissioners where one person ultimately came in contact with 36 different people that could have been infected or quarantined. So, you know, when you start looking at the math as far as how quickly the virus can spread and how many people could be impacted, I kind of fall back to the position that the more we can do to keep it slow, the better.
Right. Well, thanks, Doug. That was some great information, and I would echo what Keith said. Thanks for all the hard work you're doing on behalf of the county. It's really not an enviable position, I'm sure, but as you know, we would like to vaccinate 50 children against polio in your name, and maybe soon we can start vaccinating 50 seniors against COVID. Maybe for the next update. So.
If I may, Freddie, I think, as many of you know, I've been a big supporter of Polio Plus, and I'd like to contribute $100 to my Paul Harris for Polio Plus. Certainly the fact that we, Rotary, the world, has eliminated the virus in Africa. I believe Nigeria was the last country. That's certainly a momentous time, so I'm happy to donate $100 toward Polio Plus. And again, if anyone has questions, feel free to reach out to me. My email is at the county website, or dhunt@co.lincoln.or.us, or call the office 541-265-4100. And again, there are no good choices. I'm trying to make the best decisions, and my fellow commissioners certainly are too. So thank you.
All right. Well, thanks again, Doug, and that was really great info. Keith, do you have makeups and attendance?
Well, Jim's been doing a great job, as everyone can tell from their inbox on their email. He just takes care of the makeups. The attendance today, we have 29 members and about 69 total, so we're right at 42%. For the 50-50, well, I guess the member incentive today, spun the wheel, and Lola was the member incentive. Is Lola here today?
She is. Yeah.
She is. Good. So she won the $10. Tiana wasn't here last week, so it's $10 this week. And then the 50-50 drawing, it's $60. And spun the wheel, and Kathy Heater is the 50-50 winner for $30.
All right. And John, do we have a award for social media?
The social media award winner is Raina Matson this week.
All right. All right, so next week we have another great program. D Team is going to talk about the Olalla Center, so be sure to join us next Thursday for that. And would anyone like to take us out with the 5-way test?
I can.
Okay.
I don't have the little card, but the 4-way test of the things we think, say, and do. First, is it the truth? Second, I can't hear anybody. Is anybody going with me here?
Is it fair to all concerned?
Third, Will it build good?
Goodwill and better
Goodwill and
friendships.
better friendships.
Fourth, will
Will
it
be
be
beneficial to all concerned.
fifth? Is it
Is it fun? All right. Well, thanks everyone. Good to see you all, and hope you can make it back next Thursday for the Olala Center program.